Hey everybody, welcome back. Today we're going to be doing another version of a short leg cast. It is called a posterior tibial tendon dysfunction cast. Not a very common cast. Most people that suffer from PTTD are usually put into walking boots, lace up ankle braces, some sports taping. A lot of people that suffer from the PTTD are athletic types, sports, runners, tennis players, etc. So it's been requested that we demonstrate this particular cast, which, like I said, is another version of a short leg cast with a few modifications, which we're going to get into now. So in some short leg cast videos you guys have seen, we have used the cast stand. There's been other videos where you see me having the patient laying down on their stomach. For the PTTD, it's going to be more beneficial to have them laying down. The cast stand can work, but some of the shaping you have to do where the arch mold would be, it's a little bit harder when they're in the sitting position. So we're going to go ahead and remove this and have him lay on his belly. So in his foot, you can actually see where the arch mold is. When you have a patient that is suffering from that tibial dysfunction, when they go to flex the foot, it doesn't create the arch the way a normal foot does, because they're having their complications here in the posterior portion of the lower leg. So what you're going to want to do, just like when they do in the tape jobs, when they're taping, whenever you see sports wrap or sports tape on a PTTD patient, you'll see them, what they'll do is they'll start the tape right at the bony prominence right here of the fifth metatarsal, and you'll see them wrap the tape in the direction of where the arch mold would be, and they'll bring it around at a slant. And they do this on purpose because the idea here is that it's kind of turning the foot in a little bit as they're taping. And then what's going to happen as they come around and they secure the tape, what's going to happen is when this person goes to weight bear, when they go to weight bear, their foot, of course, is going to go flat. And as it goes flat, that tape pulls with a little bit of tension there, and that helps promote the return of the arch mold. It sends a signal to the brain that, hey, I've got a little bit of tension here, and that's going to help, hopefully, one, relieve some of those signs and symptoms when you're doing the tape. Now, when you're doing a cast isn't the last resort. The last resort, of course, is surgery. But on the way to thinking about surgery, that you may have a provider that is asking for more limited range of motion than they're getting with, say, for example, a boot, or say, for example, an ankle lace-up brace. So in which case they're going to ask you to make a cast. Now, the only thing different between what I'm doing here and a regular traditional short leg cast is I'm paying a little bit extra attention to where his arch mold would be, because in a PTTD patient, this is going to be flat. So you want to promote the idea of getting his arch back. Sometimes the provider will put them in this particular cast for 2 to 3 weeks, maybe longer, and so that they can calm down the swelling, calm down the aggravation, create some relief for the discomfort before they get them into physical therapy. So what I've done, prior to putting the stockinette on, I've done a couple of passes in the direction that you would have the sports tape. So again, when I go to put the cast on, and of course I'm going to put him in a weight-bearing position, about 5 degrees dorsiflexion, flat surface here, and as I bring him back to this direction, it's going to give you just a little smidge of tension right there to help pull that in the position it would normally be in. So that's the first trick. And we're gonna go ahead and get the stockinette on and move on to the second part. So as you noticed, as we were fast forwarding through the leg portion of the stockinette and the cotton padding, I want to get that out of the way. You guys, we've got like 80, 85, 90 videos up already. So you guys already know what this is all about. You've seen all the other short leg videos, but I want to emphasize the 3 or 4 little things different about this PTTD versus a traditional short leg cast. So earlier, before I put the stockinette on, you saw me do a couple passes of cotton. Get that wrinkle out of there. And you saw me do exactly like this. I came around the base of the 5th metatarsal and I pulled with just a little, I don't want to rip it, but just a little bit of tension. And as I pull with that tension, it's going to make his foot want to curve in a little bit. So I'm doing that on purpose. I'm doing that on purpose. I want to create tension there and I want to go in this direction, not only with the cotton, but with the fiberglass as well. Or if you're rolling plaster, either way. Plaster or fiberglass, I'm going to roll this direction because I want to create that little bit of turn there so that when I go to place them, as it starts to cure and it starts to harden and I place them in the flat position, it's going to pull that little arch mold a little bit up and it's going to keep it pulled up the entire time he's in the cast. So, okay, now the padding, this should all look very familiar to you guys. The first thing you guys are thinking about right now is, wait a minute, we all know this is going to be a weight-bearing cast, and you're asking yourself, every time we see you make a weight-bearing cast, you do the reinforcing strips of cotton on the bottom to allow for that little extra bit of cushion. You still do that with this cast. The only difference is that I'm doing them after the fact. I want to get that little bit of extra tension right here so I can emphasize where I want that mold to start mentally happening, physically happening with the aid of just the cotton alone. The other thing too is I want to emphasize that we want to get at least to 95. I want to get about 5 to 7 degrees of dorsiflexion on purpose. Again, we know that if we overflex or hyperflex, dorsiflex the foot, we're going to get more stretch out of the Achilles. And the more stretch you have in the Achilles, it's going to promote, hopefully promote more of that arch development. So we're still going to do the straps, but here's one more thing as well. If you really, really wanted to make it comfortable for the patient, you can take a little piece of material, feather out all the edges like this, and you can actually place it for a little bit more emphasis where the arch mold is going to be. You want to put a little extra padding there because when we go to put the fiberglass on, I'm going to use the butt of my hand and make a nice solid arch mold right there. And then here's the final step with the cotton. You go ahead and lay those strips down. And you just kind of feather them in. Just feather them in just like that. Nice and easy. I'll do the same thing on both sides. I'll feather them in. And now, you guys, we're going to move on. This particular cast, I'm going to make it out of fiberglass. You can do the same cast out of plaster. Go ahead and come down. Right there's perfect. Make sure you don't have any wrinkles. Okay, we're going to move on to the next step now. So you guys, as you saw a second ago, as we sped through the leg portion of the fiberglass, I wanted to get that out of the way real quick. I want to spend more time on the foot. When you come, again, you'll notice I'm rolling the direction of how, now watch, I'm going to put just a little bit of tension there. You can do that because you're not dealing with a fracture. He may have a little swelling, maybe, from the actual PTTD condition, but he doesn't have any significant swelling from an actual injury fracture type thing. So you can put a little tension where you want to emphasize the redevelopment of that arch mold. So again, as I come right to the midfoot there, the mid-plantar surface, I'm going to go just with a little bit of tension, just a little bit, not a lot. And you can actually see, as they're recording, you can see how his foot wants to turn in the direction of not only the cotton, but the fiberglass. It wants to turn that direction. So then what I'm going to do, as I fold this over and prepare it for the weight bearing, as I do this, I'm going to have you come around this side. And I'm going to keep him dorsiflexed. Now what I'm going to do is I'm going to start using this hand to bring his foot in a flatter position, more neutral. And as I do that, okay, now go ahead and come back around. So I'm using my left, in this particular case, I'm using my left hand to give him that flat weight-bearing surface. And what it's doing is it's pulling a little bit of pressure, just a little, hopefully not too uncomfortable. But as I do this, it's bringing this nice and rigid, and it's going to want to help pull that mold into that shape without a lot of pressure from your hand. This hand's going to still keep holding him, so as you're looking at it head on, it's going to look like a T. And then we're just going to keep going back and reminding the bottom of the foot, hey, this is where your arch mold is supposed to be. And we're going to do the same thing when we put the next layer on with the color. Okay, we're going to go ahead and go on to the next layer. I'm going to keep coming back and visiting this. And then the other thing I'm going to do, I'm going to put my hand in this position and I'm going to start shaping that Achilles. Right now, it needs a couple more layers of fiberglass to hold my molds, but I'm just kind of getting it started. So let me go ahead and get the colors ready. So as I'm finishing up this top layer, this color and reinforcing layer, you'll notice I'm just laying it on. I'm still laying it in the direction we've been talking about throughout the whole video. Of course, we're going to end the video upon request with the patient bearing weight on the cast. There was another comment in another video about how the patient's short leg PTTD cast felt like it was overly thick, or maybe a little bit overly heavy. You don't have to necessarily make it any heavier or any thicker than a standard weight-bearing cast. However, sometimes they will place strips of fiberglass, just like I did the strips of cotton. They'll do 2 or 3 strips of fiberglass on the bottom if they expect the patient to be doing a lot of weight bearing. Again, I'm using my left hand in this video to hold the foot in a T-shaped flat weight-bearing surface, and I'm going to use the right hand to make that pseudo, just so you can see, make that pseudo arch mold there, sending the brain the messages like, hey, we need to get this back to where it's supposed to be. We're keeping them slightly dorsiflexed to keep this part nice and stretched out. The more we flex this down, the more it's supposed to create an arch. A nice flat gastroc mold, just for fitting purposes. Edges, of course, are always soft. Cast is always hard. We'll get them a cast shoe in just a moment, and then we'll wrap up the video. But again, the emphasis, the things to take away from this particular video versus a traditional short leg video, on this particular cast, the PTTD cast, 5 to 7 degrees dorsiflexion, definite Achilles mold, gastroc mold, and without a doubt, you want to roll the fiberglass and the cotton in the same direction that you would wrap the sports tape, and use your hand to help those 3 things, the direction of the rolls and your hand, to get that arch mold, to get that patient's arch back to where we want it to be. Depending on the provider, this will stay on for a couple weeks, a few weeks. Then they'll switch them, they'll transition them to either PT activities or maybe to a boot or maybe both. All right, we're gonna let that dry and cure for just a few seconds while we get him a shoe. So come on back. So as you can see, we have a weight-bearing PTTD cast. Again, thank you all very much for watching. We have a list of about 3 or 4 more videos on queue that we're going to try and knock out in the next few days and get them up and posted for you. For the particular person asking for this video, please accept our apologies for the wait time. I hope you enjoy the video, and thank you guys very much for coming back to the channel.